All right, people are still filing in. As soon as it looks like it's slowing down, we'll get started. I'll probably give it one more minute. Okay, I think we're ready to get started. Hi, everyone, and thank you for attending Envia Fertility's patient education webinar on menstrual cycles and infertility. My name is Vicki, and I'll be your moderator for this informational session. I'm honored to present to you the speaker of our webinar, Dr. Elizabeth Puscheck. Dr. Puscheck trained at the Washington University Medical School in St. Louis and then completed her fellowship at the Medical College of Georgia. She has specialty interest in ultrasound and takes care of the full range of infertility patients. I look forward to her presentation today. Envia Fertility Specialist has 3 physicians in total, Dr. Puscheck, Dr. Karande, and Dr. Klipstein. All 3 of these physicians are board certified in the specialty of obstetrics and gynecology and the subspecialty of reproductive endocrinology and infertility. We also have 4 locations for the convenience of our patients. Our main office is in Hoffman Estates. That's where our surgical suite and embryology lab are located. We have satellite offices in Arlington Heights, Crystal Lake, and Northbrook. If you have any questions during the webinar, please type them in the Q&A box, and we will have time at the end for a question and answer segment with Dr. Puscheck. Now I'd like to turn this over to her to start her presentation with us on menstrual cycles and infertility.
Sorry about that. We had a little technical issue there. I am delighted to talk to you about your menstrual cycle and infertility. And let's see if we can get this slide. There we go. So when we're talking about your menstrual cycle, it certainly is a time when you're trying to get pregnant and you get your period. It can be very depressing because that's the time period when you realize that you're not pregnant. So I have a lot of patients who ask me a number of these little circle questions here. Am I normal? Are my periods regular? And what does regular mean? Am I ovulating, and am I timing intercourse at the right time? Is there something wrong with me, and what could be wrong? What can I do to improve my ability to get pregnant? And do I need to see a doctor? Well, these are a number of the questions that we're going to address tonight. So let's go back to basics. Many of us remember our grade school class where we heard the menstrual cycle is 28 days. Well, it's really pretty amazing that only 15% of women have 28-day cycles, and that's what we call a normal menstrual cycle. So obviously, normal is beyond just a 28-day cycle. And what is normal? Well, when we think about a normal menstrual cycle, we think of a normal range of 21 to 35 days. But it really varies. It varies for each woman, and it varies from cycle to cycle within the same woman. The way we count the menstrual cycle so that we know we're in the normal range or not is we count from the first day of the period starting, the first day of real flow, and then we count it all the way out to the first day of real flow of the next period. So I've had some patients who told me that they have short cycles, but they're counting from the last day of the period until the first day of the next. And that's not what we're talking about. We want to go from the first day of real flow to the first day of the next period's real flow. And that's going to give you your range. And if that range is between 21 and 35 days, then it's actually normal. And it's interesting because you think of menstrual cycles, they don't have to be the same from month to month. So 1 month, a period might be 25 days from the first day of the cycle to the first day of the next. And then the next month, it may be 30 days, and then 32, and then 26. And even though these are all different numbers, different menstrual lengths, these are all within the range of a normal menstrual cycle. So this can be very normal, even if you're having all these differences in the same woman. So none of the above here that I'm talking about is considered an irregular menstrual cycle. But if you're outside of these ranges, if you're less than 21 days or more than 35 days, then it would be considered irregular. So why does the menstrual cycle vary so much? Well, the menstrual cycle can be described first in 4 phases. And if we think about these 4 phases, you'll see where that variability comes from. So the color codes are going to help you in the next slide as well. So phase 1 is going to be the period. This will be the time period of actual bleeding. And for most women, that time period is 3 to 7 days. And again, that can vary from month to month as well. The second phase is what we call the follicular phase. And this is the time period between the period and when ovulation happens. And this is the most variable time period. This can be 10 to 20 days. And then the third part would be ovulation, and this will be the release of the egg. And that release of the egg isn't a pop. It happens over time. And we know from literature studies that the most fertile time period is going to be the day before ovulation and the day of ovulation. Once you're beyond about 24 hours after ovulation, that egg's not going to be able to be fertilized anymore. Okay, so that's the third phase. Now the fourth phase is called the luteal phase. And the luteal phase will be from ovulation to when the next period starts. And this is the one that's rock solid. This is 12 to 14 days in every woman from every cycle. It's very consistent. It's the rock. So this is why we have so much difficulty in predicting when we're going to ovulate, because that first part is so variable. If the first part were more consistent, then we'd all know when to time intercourse. But it's that first follicular phase that, that can be so variable and makes it difficult to predict when you're going to ovulate just by being familiar with your menstrual cycle. Well, a number of women will use what's called a basal body temperature chart to help time when they're going to be ovulating. And this chart here is an example of one. And I put the different phases on the bottom. So 1, again, is during the period, and you can see the period being marked off. Oops, let me put a little arrow here so you can see it. 1 second here. Nope, that's not going to do it. Sorry about that. I think I hit the wrong button. I might need to see if I can get, well, anyhow, let me see if this can undo. There it goes. Okay, so let me get to the point where I can put the little pointer on. Okay, here's the laser pointer. So this is phase 1 here. Is where the menstrual cycle is, and you can see it shaded here. And then the second part, the follicular phase, this is the most variable part. And when women are doing a basal body temperature chart, you're using a special basal body thermometer. You have to have had a good night's sleep the night before without getting up for a glass of water or go to the bathroom or anything. And then you check your temperature for a period of time, first thing in the morning before you get up or do anything. This portion may bump up and down a little bit, and you never really know when it's going to go up and then stay up. And so that's why the basal body temperature chart isn't always the easiest to look at when you're going to ovulate, because when you have this lowest point and then it goes up, you know that this is the time period that you ovulated between the low point before it goes all the way up. Once the temperature goes up a good 0.5 degree or more and stays up, this is due to your core temperature being higher from your progesterone being a little bit higher after ovulation. So it's easy to look at a basal body temperature chart after the month is over and say, oh, I ovulated back here. And again, that's the third phase is ovulation. And then the fourth phase is the luteal phase. And it's this phase that stays consistent from month to month. And then the period will start again. So the basal body temperature chart has been one thing that women have used to try and time their intercourse. But again, it can be difficult to pick this up because it can bounce around a little bit before it goes up and stays up. The next thing that I find actually very helpful for my patients is the ovulation predictor kits. Now, there are a lot of them available on the market, and these are just a couple of the ones that are out there. I happen to like the ones that are blue or have a little smiley face better than, say, a pink one. But all of them work by the same mechanism. They're picking up the LH in the urine. And so they can pick up the LH in the urine on the way up at ovulation and on the way down. Now, the surge happens about 10 to 36 hours after you see this surge in your urine kit. So it gives you an idea of when it's going to be happening, but in advance. So again, this is the follicular phase, that variable part. It picks up your ovulation 10 to 36 hours before you ovulate. So if you have a positive kit, you want to have intercourse that day, and then every day or every other day for a couple of days. So points out the fertile time period, but it gives you that information in advance, which is helpful. So let's get back to talking about the menstrual cycle. And the menstrual cycle is really a very well orchestrated ballet. I like to think of it that way, because in order for the menstrual cycle to occur, we have to have all of these things working together. So we're going to have the ovary with its oocytes growing, and then ovulation and the corpus luteum. The basal body temperature chart, again, low, and then after ovulation, it's going to go up and stay up. So these all have to be coordinated. And these are coordinated by the pituitary hormones that are the FSH and then the LH surge, which is going to give us that ovulation and then the temperature being up. We can monitor blood ovarian hormone levels of looking at estrogen, and that estrogen level needs to stay up for a period of time before ovulation occurs. Then there's a little drop in the estrogen before the luteal phase. And then we have the actual endometrial lining. And so right around the time of the period, this is all sloughing, okay? And then the estrogen is helping the endometrium grow. And then around ovulation, the endometrium is going to change and have these kind of larger irregular glands, which we see as the uterine lining goes through this luteal phase and decidualizes. So again, we see the follicular phase and the luteal phase, and then the period on both sides. So all of these things have to work together. Your pituitary, which is releasing these pituitary hormones that are signaling to the ovary, and the follicles start to grow. The follicles are making estrogen. The estrogen is going through the bloodstream to signal back to the pituitary, and it's also signaling to the uterus to grow the lining. So it's a very well orchestrated ballet, and everything has to work together in order for it to be a normal menstrual cycle. So what do regular or normal menstrual cycles tell me about fertility? So if your periods are coming every 21 to 35 days, then you are probably ovulating. Most women are ovulating if they have regular cycles. But if it's not exactly regular, some of the things that you can do to help this out is you can optimize your weight. So if you're underweight, you can gain a few pounds. If you're overweight, try to lose 5 to 10% of your body weight, and that sometimes resets your whole pituitary ovary uterine axis, and you'll have your cycles restart. You want to eat more healthy, get a good amount of sleep, and decrease stress as much as you can. I know that's difficult, particularly in this COVID world, but those are some of the things that you can do to help optimize your cycles. Well, if your cycles are irregular, they may be presenting in different ways. So you may have one of these 4 presentations: irregular cycles, prolonged bleeding, so bleeding for a month or more at a time, spotting, which would be some bleeding in between your periods, and then no periods. So I'm going to talk about each of these topics individually. And if you're having problems with any of these ways of having an abnormal cycle, you need to see a physician. And if you're interested in fertility, you need to see a fertility specialist soon. You don't need to delay. You do not need to wait for a year of trying to get pregnant. If you're having abnormal menstrual cycles like this, then there's something that we need to address so that you can increase your chances to get pregnant and have things more normal. So irregular periods may be periods that are too short from the beginning of one cycle to the beginning of the next, or too long, more than 35 days, or inconsistent, sometimes too short and sometimes too long. About 30% of reproductive age women may have irregular periods. So this usually means that you're not ovulating. And there can be many reasons why you're not ovulating. If you're having shorter cycles, less than 21 days, then I get a little bit more worried that you could have fewer eggs, because we see that women who have had normal cycles and then all of a sudden their cycles start to shorten in length, we see that happening in women that are going to be going through menopause in the next 3 to 4 years. About 70% of women who go through menopause will have shortening of their cycles before that. So that is something I'd be worried about. Of course, there are other things that can cause that too. And then more commonly, longer cycles. So more than 35 days would be another way of having irregular cycles. So some of the causes for irregular cycles can be hormone imbalances. These could be things like thyroid disorders, prolactin problems, androgen disorders, and PCO or PCOS, which is polycystic ovary syndrome, is the most common cause for having irregular cycles. Other less common things would be like ovarian insufficiency. This happens in less than 1% of women under 40. And then early signs of menopause, as I mentioned in the previous slide. So cycle irregularity makes it harder to get pregnant because you're not ovulating, and you do want to see a fertility specialist sooner. Don't wait, and we can address any of these problems. Spotting. Spotting is something where you have some light bleeding for a couple of days, say in the middle of the cycle or before the period starts. And some common causes for spotting would be polyps, and this is an ultrasound. Over here, this is what we call a 3D ultrasound. This is the whole uterus, and this is the uterine cavity, which normally is triangular in shape, but you can see there's a filling defect here, which is actually a very common appearance of a polyp. And that's what we see in ultrasound. And when we go to do hysteroscopy to remove the polyp actually looks like this. And polyps can cause some inflammation, and it can cause you to have spotting. And so, and it can be spotting anytime in your cycle. Endometriosis can also cause spotting, and I think that pathophysiology on why the spotting with endometriosis occurs is not really clear. And then cervical infections is another cause. So if you have an infection in the cervix, you may have a discharge from that, and that cervix can be more inflamed, and you may notice spotting because of the cervix starts to bleed from the infection. And sometimes you can have that happen after, you could have a number of other causes that can cause spotting as well. After intercourse, if somebody has a friable cervix from an infection, it might bleed more then as well. Prolonged bleeding is something that can also occur as an irregular cycle or abnormal cycle. And this is where you'd be bleeding for many more than 7 days. I get very worried about anemia in these cases. Some women might pass clots, some have heavy bleeding, some have prolonged bleeding that's light bleeding all the time, but it's the heavy bleeding that I get more worried about anemia. And if you have symptoms such as lightheadedness or dizziness, you need to see somebody right away because you could be significantly anemic. Again, with prolonged bleeding, you're not going to be ovulating, but we do need to see the cause for this bleeding. Sometimes one of the more common causes is something that looks like this. These are hard, benign growths in the uterus that are called fibroids, and they're really hard. They're hard like a golf ball. And the ones that get in the uterine cavity can be a particular problem because that can lead to not only prolonged bleeding, but it can also cause that kind of inflammatory response that makes it harder to get pregnant and to stay pregnant. So fibroids are very common. If you don't ovulate, you can make that estrogen, but you won't be making the progesterone, and then the lining of the uterus can outgrow the blood supply, and you get this irregular bleeding, and you can get irregular shedding of the lining, and it can bleed for quite a long time with anovulatory bleeding. And then there's sometimes when you get polyps in the uterus or cervix that can lead to more prolonged bleeding as well. And bleeding disorders, usually, you know, in these situations, you're going to have symptoms like easy bruising, and a bleeding disorder, again, is something where you can get a period that lasts a very long time, and we can evaluate causes for bleeding disorders, and you would need some treatment for that as well. And sometimes infections can lead to prolonged bleeding. Something that's not common in the reproductive age woman, but can happen, are cancers, and these can be caused by prolonged bleeding or irregular bleeding. So cancers of the cervix can happen in reproductive age women and lead to very significant bleeding, but cancers of the uterus are usually much happening in older women. But either of those can present with irregular bleeding and prolonged bleeding. Some causes of no periods. Well, if you've never had a period before, most women who've never had a period are going to present when they're 16 or so, or a little bit afterwards, because that's when we want to really evaluate what's going on. There could be a birth defect in the uterus or cervix or in the vagina. There could be a physical blockage for the blood flow to come out of the uterus. And then there could also be something called ovarian insufficiency, where the ovary just didn't develop normally. If, on the other hand, you had periods, but all of a sudden they've stopped, or they're very light, well, if they've suddenly stopped, of course, we want to make sure, to see if you're pregnant or not. But if they've stopped after a procedure, or you've had light bleeding after a procedure, you may have some scar tissue in the uterus or in the cervix. Again, it could be an indicator that you're not ovulating. It could be that you've had some changes in your weight or health status, underweight, significantly underweight, or over-exercising can give you an energy deficit. And in that case, then that whole balance of the axis would not be working well. And similarly, if you had other illnesses, oftentimes your periods may not be normal after that as well, or during the time that the illness is uncontrolled. And then early menopause can be a cause for having your periods stop. So when we're thinking about these normal periods, when should I see a fertility specialist? If they're normal, you can try for a year if you're less than 35. Use those ovulation predictor kits to help time the intercourse. And if you haven't gotten pregnant after a year, see a fertility specialist. If you are over 35, I'd recommend only trying for about 6 months and then see a fertility specialist, because as women get older, their ability to get pregnant decreases significantly. And of course, if you're over 40, don't try more than a couple of months, because we really don't want you to wait. We want to move very quickly to help you get pregnant. So that's what you can do if you have normal cycles. Now, we did talk a lot today about abnormal cycles, and if you have abnormal menstrual cycles, we want you to see a fertility specialist right away and not wait, because there are good reasons why you're having these irregular cycles or abnormal cycles. And maybe because you have irregular cycles and you have PCOS, polycystic ovary syndrome, one of the most common causes for women to have trouble getting pregnant and lead to an abnormal menstrual cycle. The prolonged bleeding may be from a variety of causes, as I mentioned, and again, they need medical attention. And spotting, polyps might be the more common things, but endometriosis, infection, you could have little growths in the vagina or cervix that can be benign growths that can lead to that as well. And then no periods. We want to really evaluate why that's happening. If you're interested in fertility, we want to address that sooner as opposed to later. And if you did have some scar tissue in the uterus, we can usually surgically remove that and get your uterus back to normal. If you're over-exercising or underweight, we can help you adjust those too. And then we have other treatments for some of the other causes for no periods. as well. So if you have any abnormalities in the uterine, in the menstrual cycle, come see one of the fertility specialists, and we'd love to see you at Envia Fertility. I'd love to see you. So I think in summary of our talk today, I hope you've really gotten the sense that your menstrual cycle is really like a vital sign for your fertility. A vital sign is like a temperature or a blood pressure. It's really put your finger on the pulse for fertility. It's so important to know your body when you're trying to get pregnant, and you want to optimize that as best as you can. So I am really looking forward to your questions, and I want to thank you for watching our webinar today. And Vicki, I'm going to pass this back over to you so you can let us know who's ready to ask some questions.
Sure. Thank you for that talk. Let's see questions that have come in. Let's start with, why is light spotting not considered day one of my cycle?
Well, that's a good question. So if you're having light spotting, it's not really clear if you're starting to shed your uterine lining or not. And so, you might have spotting and then it stops and goes away. Well, then that wouldn't be your period. So we really want to have the first day of real flow so that we know that you're sloughing your lining, and this will be going to your follicular phase and moving forward in your menstrual cycle. So that's why we like to have that be a first day of real flow, so we know it's not just an incidence of spotting.
Okay, perfect. And then am I more likely to have success getting pregnant if I have a regular cycle versus if I have an irregular one?
So most women who are having regular cycles are going to be ovulating. And there's a small percentage of women that have regular cycles that are not ovulating, but for the most part, regular cycles from the beginning of one cycle to the beginning of the next, being 21 to 35 days, you're probably ovulating. If you have irregular cycles, you're probably not ovulating. So it's going to be much harder to get pregnant if you're not ovulating. And we need to evaluate you and help you ovulate. And I can tell you that of all the problems that we see in infertility, it's those irregular cycles with the PCOS problem that is probably the one with the best prognosis, because it means you have lots of eggs, and we just need to help you with ovulation. That's usually a very easy fix with even low tech approaches.
Okay, and can taking this specific question says the oral birth control pill, but there's another question about the Depo-Provera shot. If I take them for extended periods of time, talking 10, 15 years, would that affect my cycle and my fertility when I come off of it?
Okay, sure. So if you have been on the birth control pill for a period of time, now the birth control pill is basically hormones. It's basically replacing those hormones that your ovary would be normally making. And so now there's no signals going to the ovary to build that lining and to ovulate. So when you stop the birth control pill, the first period that you have when you stop the pill is what's called a withdrawal bleed. And then usually your next period is going to start within the next month. Sometimes if it doesn't start, it might take up to 3 months for you to get back into your normal menstrual cyclicity. Now, keep in mind when you're taking the birth control pills and the period that you're getting on a birth control pill, that's kind of an artificial period, because we're kind of giving you those hormones. When you're stopping the birth control pills, even if it's been 10 or 15 years, your own cycle is going to be going back into sync with that whole ballet approach that I mentioned. And part of that is genetic. So if you had irregular cycles before you started the birth control pills, then you'll probably have irregular cycles when you stop the birth control pills. If you were genetically kind of preset to go through menopause at a certain time, just because you had been on birth control pills doesn't mean that when you stop it, that you're going to extend and go into the menopause later. You'll still go through menopause at that same time in your life. So the birth control pills don't make you go through menopause earlier, and it doesn't make it delay your menopause either. So I hope that answers the fact that if you're on pills for a long period of time, you may get lighter periods while you're on those pills, but when you stop them, your own body is going to take over and it'll do whatever it was pre-programmed to do. If you
Oh,
haven't got a period 3 months afterwards, you should see a specialist and we'll evaluate what's going on.
perfect. That definitely answers that question.
You had a question about the Depo-Provera too. What was that one about?
Same one, same question.
Oh, okay. So Depo-Provera is a little bit different because that's an injection that women take for contraception, and it works very well, but it's one shot about every 3 months. So in that situation, when you stop taking those shots, it might be 3 or 4 months before your period would start. And in that situation, we let you go a little bit longer so that if your periods haven't started and become regular within the year, then we need to do an evaluation. So a little bit different.
Okay. Another question, what is the reason for breakthrough bleeding in between cycles?
Okay. So most of the time when people talk about breakthrough bleeding, they're talking about breakthrough bleeding when they're on a birth control pill. And if you're having breakthrough bleeding on a birth control pill, it can be due to a change in a birth control pill. It could be because that estrogen level in that birth control pill is very, very low. And maybe the endometrium had gotten damaged a little bit and doesn't have enough estrogen to kind of repair itself. And so those can be reasons, why you would have some breakthrough bleeding, or you might have an IUD and you could have some bleeding in the middle from that period, from that reason from the copper IUD. You're talking about breakthrough bleeding during a normal menstrual cycle. We often call that more spotting, but that can be due to polyps, the endometriosis, and things like that. Irregular periods can also cause some breakthrough bleeding if you have shedding of the lining a little irregularly, and then it stops for a while, and then because the estrogen can repair it. So that's a little complicated answer. I hope that answers it well enough for you.
Okay, we had a question come in from an attendee. That's,
Okay.
can you use the basal body temp method for ovulation if you're not getting a full night's sleep with no awakenings or bathroom breaks?
So the basal body temperature chart is really depends on you getting a good night's sleep, 6 to 8 hours of sleep. So if you end up getting up in the middle of the night to go to the bathroom, if you end up getting that glass of water, then that temperature in the morning is not going to be your lowest temperature. And so it's not going to be as reliable. So it doesn't really work very well then. So I wouldn't recommend it. Try an ovulation predictor kit instead.
Okay. Let's see. How can I track my cycle when I have PCOS or amenorrhea?
So if you have PCOS or amenorrhea, then you're not getting your periods at a regular time. They're just not coming at all if you have amenorrhea, or they are coming very irregularly, maybe every 2 to 3 months or every 6 months with PCO. It's really difficult to track that on your own. I'd recommend that you see a physician, in particular a fertility specialist, if you're trying to get pregnant. And again, we'd be happy to see you, and we can help you ovulate. And well, first of all, evaluate what the problem is and then help you with getting pregnant.
Okay, and what does it mean if my periods are very light and only usually last about 2 to 3 days?
Well, it can be a little bit difficult to determine why it's very light. It can vary from woman to woman and from cycle to cycle, but most of the time it'd be indicating that you have a thinner endometrium at that time, or you're having bleeding not just from below, it can also go through your tubes and into the abdomen, and that might be a little uh, disheartening to think about that, but your body just absorbs it and breaks it down, and it's not a problem. So those could be a couple of reasons why you have a lighter period, and it can be very normal to have a light period.
Um, let's see. I'm not sure how this one relates, but does hypo or hyperthyroidism affect your cycle and fertility?
Yeah, so that's one of the hormonal imbalances that we talked about earlier. So if your thyroid gland is underactive or overactive, it can lead to irregular periods. The more common one is the underactive thyroid. That gives you a higher TSH level when we measure it, And a lot of it's not a lot more prevalent to have the hypothyroidism, and it can often lead to irregular cycles where you're missing, even missing a whole period and everything. So very easy to treat. A lot of women who have the low thyroid or the hypothyroid will usually feel kind of tired or lethargic and maybe getting cold when other people aren't cold. When you get treatment, you feel a lot better and have a lot more energy. On the other hand, the hyperthyroid situation is much less common. All of these things happen, though, more commonly in women than in men. And with hyperthyroidism, then you're going to have maybe sweat a little easier, your heart races a little bit more. And again, you can get irregular periods with this as well. And we can treat hyperthyroidism also pretty easily. So you want to get that evaluated and get it treated, and then once it's treated, we'll help you get pregnant.
Okay, and then one last question. I'm not sure if it's related to fertility and fertility, but it's a question that I'd be interested in hearing the answer to as well. And that is, how can I manage my PMS symptoms and cramping?
Okay, sure. So PMS symptoms are premenstrual symptoms, and usually women have these types of symptoms. Might be cramping or bloating, discomfort. Some people even get migraines during this period, and it's usually the few days before the period would start, or it can even happen anytime in the luteal phase. But once the period starts, and within a couple of days, those symptoms totally go away. That would be what PMS is about. And then cramps, of course, are very common with anybody having a menstrual cycle, and particularly an ovulatory menstrual cycle. It's very common to get cramps, and those cramps can best be controlled by using an antiprostaglandin, which would be like an ibuprofen product, an aspirin product. Those tend to work the best. Regarding PMS, usually PMS, it can depend on how bad it is and what you want to do. If it's just the cramps, then certainly the ibuprofen products can be helpful. We can address each of the different complaints of PMS individually. Or on the other hand, if it's really problematic and you're not interested in having kids, then we can also give you a birth control pill and give it to you continuously, or one of those birth control pills that goes for 3 months without getting a period. And then, of course, if you're not getting the period, you most of the time aren't getting the PMS symptoms either. So those are a couple of things that can be really helpful.
Okay, we actually had two more come in. Do you have a minute?
Okay. Sure.
One is, if I'm still getting my period, regardless of my age, does that mean I'm fertile?
Okay. So probably age is the number one factor that's going to let you know about your fertility, because as you get older, that pregnancy rate goes down considerably. If you are still getting your period and it's coming regularly, again, as I mentioned before, most of the time you are ovulating, and so you could get pregnant. So it's interesting when we think about women who may not want to get pregnant, like women who are in their teens or women in their 40s, maybe the mid 40s or whatever, may think that they can't get pregnant in the older years. However, if you're having regular cycles, you certainly can get pregnant, and that's where we have the highest incidence of unwanted pregnancies, is in the teens and in the latter 40s, mid 40s, things like that. But if you're having regular cycles, certainly you could be ovulating. Most of the time you are, and you could still be fertile. But as you get older, it's going to be a lot harder to get those eggs to fertilize and implant and go on to a normal pregnancy, because there's a higher incidence of what we call aneuploidy, which can lead to, I guess the most common aneuploidy that we're all familiar with is the Down syndrome. So that increases as we get older too. So a number of those other aneuploidies are not compatible with life, and you'll end up miscarrying them. And sometimes even you'll miscarry them before you even knew you were pregnant and just have a little heavier period. So yes, absolutely. If you're still having your periods, you can be ovulating. It's a small percentage of women with regular cycles that are not ovulating, but that's a small percentage. Most people are.
Okay, now for real, last question.
Okay.
Having clots in my period cause concern, and what does it mean?
Okay, so if you're passing clots, I get worried that you're bleeding really heavy and that you should see somebody to make sure that you're not anemic. That is, if you're passing multiple big clots. If it's a little teeny clots, it's not uncommon to see a couple of those during your menstrual cycle, so that I wouldn't worry about. And the clot is just that you're bleeding and that it has a time to actually make the clot before it's being released. So it's either, it might be more common if you're sleeping, then you get up. There may be blood in the vagina that's had time to form that clot, and then it is released. But if you're having a lot of heavy bleeding and passing clots, then I'm worried that you may be getting anemic and you want to see somebody pretty quick, especially if you're getting dizzy or lightheaded.
Okay, perfect. Thank you so much to all the attendees of this webinar for submitting these questions for us to go over. Thank you also to Dr. Puscheck for sharing this information with us. Please check our website for dates of future webinars. If you have a question that we didn't get to, or if you think of something you'd like to ask after this is ended, please send it to the email on your screen, which is info@inviafertility.com. You can also visit us on our website, social media pages, and of course, you can call our office to schedule an appointment if you want. Thank you so much. Stay safe and healthy.
Thank you. Have a good evening.